this whole process? I know we have to come to the office and you're going to.
So we do do the history, talk about what's going on. We do the blood work, and we bring him back, and then we start him on these medications. Bring him back about every 6 weeks, like we do our normal hormone program. We do also want to make sure that they're on progesterone and they're also on thyroid, because these two hormones suffer in this disorder as well. Incidentally, if you look at the research, there's a 26-fold increase in risk in breast cancer, uterine cancer, and ovarian cancer in women with PCOS.
Ooh.
So, and the main reason is that estrogen is going up, which increases your risk for ovarian and uterine cancer, but also your progesterone drops because of that, and that's what increases your risk for breast cancer. So you want to get the progesterone in and get this disorder under control, because there's a lot of health issues that can occur with this, specifically the risk of cancer, and that's big for women. I mean, it's big for anybody, but we need to get on top of that. So.
Wow, we only thought if we were 45 we had problems. I didn't realize that a teenager could have PCOS.
Yes, and that's the genetic version. And a lot of people ask me, how long do I need to be on this medication? Well, if you're young and it's the genetic version, probably for life, because it's genetic. Unless we find something that can change it or fix it, then that's something we can do for it. If you're older and you've acquired it, you never had this issue before, all of a sudden because of insulin resistance, because you gain weight or whatnot, if you lose the weight, maybe it'll go away. But for the most part, what we do is try it, lose the weight, see how you feel. If you feel good, then we take a trial off the medicine, see what happens. But if you start having those issues come back, then we know, yeah, you're probably going to have to stay on it.
Is PCOS, before you leave out today, is PCOS misdiagnosed?
Yes.
Okay, I was going to
Well, remember, a lot of the traditional medicine, we treat the symptoms. We don't really treat the actual problem that's occurring. So we'll treat, hey, you have cysts on your ovaries. Well, maybe we need to take the ovaries out. Oh, you have irregular bleeding. We'll just put you on birth control. Incidentally, birth control is one way to treat this, okay? I don't try to use it unless it's a secondary and we're having a really hard time getting it with the current plan that we have. The other thing we do employ, a lot of the women have hair growth, hair loss on the head, and acne. We also employ spironolactone in this. It also helps because there's a problem with the adrenal glands in women who have the genetic version of, they have an aldosterone issue. Fancy hormone that does salt in your body. But incidentally, we have to treat with spironolactone in these cases because it can cause problems with health. It's called adrenal hyperplasia is what the disorder comes from when you have the problem with PCOS. Okay, so we do use spironolactone, which is basically a medicine that blocks testosterone at the peripheral tissue and also regulates the adrenal glands. So we want to make sure that we reduce the risk of the hair, the acne, if they already have it, and we want to kind of remove it. It takes time to do it. It's not going to be immediate. But you want to do that with that and also try to take care of the adrenal issues. So.
Well, we like the Revita approach. Wow, this is just amazing how PCOS can just, I'm not going to say it can just, we won't live a life comfortably.
Yep.
We're always going to be self-conscious about the weight or the hair, the facial hair, and then the hair loss on the head. It just seems like life's playing a joke on us, but you balance that out.
Yeah. Well, the good thing about this is there are other reasons for why people gain weight and lose weight. It's not just calories in and calories out. And that's a very simplistic way of looking at it. When we talk about thyroid again in the future, you're going to see that even thyroid is affected by your dieting and exercising to the point where it can actually lose its function in your body. And so you're going to have to exercise more and diet more because your thyroid starts to lose its function, which is your metabolism. So metabolism hormone. So there's so much to it than just calories in and calories out.
Okay.
You know, we have to look and see what is the main core of what's causing the problem. If it's PCOS, let's take care of that. Let's fix that problem, or at least alleviate it as best we can, so we can give you the best chances of improving your health. So.
Awesome. The Revita approach, Revita Medical, 704-847-0011, revitamedical.com. Thank you so much.
Thank you, Francine, for having me.